A Filipina children's rights advocate, is among this year's recipients of the Ramon Magsaysay Award, regarded as Asia's version of the Nobel Prize. Dr. Bernadette Madrid joins us now to share her journey. Dr. Madrid, congratulations. Thank you so much for joining us on The Final Word.
Thank you. Thank you, Rico. I'm glad to be here this evening.
What does this Ramon Magsaysay Award mean for you and your fellow crusaders?
Well, it recognizes the work that we do, that it is important, and I'm hoping that this award will amplify my work, not only mine, but really everyone that's involved in child protection in the Philippines, because we are all working together to really stop the scourge of child abuse in our country.
And Doctor, you created these child protection centers across the country to help domestic abuse victims. How challenging was it to create these safe spaces?
Definitely very challenging. When we first started at the Philippine General Hospital 25 years ago, we were just thinking of one clinic for abused children. But very fast, we found out that one clinic is not enough to serve our country. We needed at least one women and children protection unit in every province. And that took a lot of partnerships with the Department of Health, especially, and the local governments, so that this will become a reality. Right now, we are present in 61 provinces, and there are still 20 provinces where there are no women and children protection units.
And Doctor, your work continues. It is not over. What still needs to be done to champion the rights of the most vulnerable and integrating child protection into the country's health infrastructure?
First of all, we really would like all those 20 provinces to have a women and children protection unit. That's basic. And then we need to be able to sustain all of these women and children protection units with support, as I said, from the Department of Health and the local government. Even with the universal health care, we should be integrated into that so that any abused woman or child in the country should have access to multidisciplinary services within at least 2 hours. Now we're also innovating such that we are looking at how telemedicine could further extend our reach so that those unreachable places will also have access.
Doctor, you wouldn't be where you are today and you wouldn't be receiving your award if you did not take up medicine at the University of the Philippines in Manila. Share with us your journey. Who was your major influence to study medicine and pediatrics?
Well, first of all, I come from a family of doctors. I am from Iloilo, and I grew up with a dozen cousins, first cousins, who are all doctors now also. But we all went our different ways on what we specialized on. And early on, I already wanted to be a pediatrician. And as a pediatrician, in the beginning, I didn't know that there were so many abused children in our country. Like in the late 80s and early 90s, it was not really recognized as a public health problem. And when I did my further training in New York at the Montefiore Medical Center, and they had an excellent child protection unit there, I realized that there were so many patients that we were missing, that we really need to take care of. And that was the first step. Okay? The next challenge was really how to make this program a reality in our country. And that needed the help of so many people, especially David Bradley, who is the founder really and first was Advisory Board Foundation and now it's City Bridge. And we have a Filipino board now, very active and really dedicated private sector that supports the Child Protection Network. And that serves as our engine in fulfilling this vision of having accessible service all over the country and even beyond.
Dr. Madrid, all Filipinos are really very proud of you because you are the only Filipino to be awarded the Ramon Magsaysay Award in 2022. Congratulations to you, and thank you so much for joining us on The Final Word. Child rights advocate and crusader, Bernadette Madrid.